One of the questions that I'm hearing more and more is, are homemade masks any good? With the increased in community spread that we're seeing, together with the dire shortage of surgical masks, this is becoming much more pertinent there. Now, just to remind everyone again, surgical masks should be saved for healthcare workers, patients that are sick, and caregivers of those patients with coronavirus there. So masks work best to prevent the spread of viruses by literally catching the droplets containing the coronavirus when you would sneeze or you would cough there. So taking that in account, I started looking on what's the data available on homemade masks, because obviously we do not have enough surgical masks around. Are they any good? Are there any studies supporting it? So here is what I discovered. So a lot of the studies actually look at the ability of the masks to filter particles smaller than 0.007 microns. That is 14 times smaller than the coronavirus. The other important thing to remember is that these are all studies done in a lab. So here's the data. N95 masks filter about 98 to 99% of particles. And that should really be limited to healthcare workers that's doing aerosolizing procedures, such as intubating a patient. So very specific group of healthcare workers that will be using it. Surgical masks filter about 80% of particles. They are cheap, but unavailable for everyday use right now. But here's the interesting thing. Homemade masks made from dishcloth can filter up to 50% of particles. So compared with no mask that will filter 0% of particles, this is not necessarily something that we should not pay attention to. So here's some food for thought. Important to remember that these studies were done in the lab, so it's not real life data that's available. We have no guidance what fabrics might work better than others, and we just have very limited information to go on right now. But we do know that it can reduce spread of about 50%. The second thing to remember is that we have to reserve surgical masks for sick patients, those caring for the sick patients, and for healthcare providers. So then the next thing is to remember that a lot of patients are actually asymptomatic or pre-symptomatic. So they might be infected with COVID-19, but not showing any symptoms yet. And that is really where we might see a role for a mask or a face covering that will cover your nose as well as your mouth. Interesting enough, in a lot of countries now, it's mandatory to cover your nose and mouth for everyone leaving their home. And that, combined with social distancing as well as hand hygiene, seems to be very effective. Countries that's enforcing, that's the Czech Republic, Slovakia, and Bosnia and Herzegovina. They now all require everyone to wear masks in public, while Austria just brought in a ruling that everyone that's going to a grocery store should be using a mask to cover their face. So do your own research regarding the possible role of homemade fabric masks as an alternative to reduce community spread until surgical masks become more freely available. As the Masks4All campaign saying, I protect you and you protect me. Something to consider, and let me know your thoughts below. I will add in the top some references to the Masks4All campaign, as well as some of the references to the studies. Thank you so very much.